2 tips on how we were able to find home care for my nana and how you can do the same thing too. But before you do that, you have to figure out 2 things, right? So I'm gonna walk you through really quickly. I am out here sweating. Oh my gosh. But anyways, so my name is Coach Kiva. I've been a part of the health and wellness business for a while. Like, I was my grandma's caregiver, and so um, we launched our own agency because my grandma needed to find a non-medical home care agency that could really provide for her, that could advocate for her and provide her top level customer service. Okay, so I'm going to give you 2 tips on how we took action and then how we figured out what type of care she needed, what type of care she needed, and then how many hours she needed. So this is really important. So we are Premier Home Care. We're right in Maryland, licensed the same month my grandma passed away. So I believe that it is meant to be. So many days I wanted to like, you know what? Let's just take a break. But no, family kept saying, "No, Kiva, keep going." And little do you know, it was a blessing. She passed on October 1st, and we were licensed October 24th, my birthday. So let me just continue. Okay. So we have non medical home care and we have home health care. So home health care is more of a skilled care with the nurse, occupational therapist, PT, physical therapy, and things like that. It must be approved by your medical physician, who's ever is caring for your loved one at the time. So for my grandmother, it was at the hospital. She even had her primary care physician as well complete the form. It was approved by Medicare. She was not approved or didn't qualify rather for other programs for seniors, right? So we knew when her health took a turn that she needed additional care. That meant she needed help with grooming, with bathing, with other daily activities to keep her to keep her home. And she made it very clear, Kiva, I am staying home. So there was a couple times she several times she did go to rehab because she needed to get stronger to be able to walk. And then one time she came home with us about 40 or some days. And then that was when I got her hospital bed. I got all those things. But that required a doctor's order. So I'm making sure very clear. So home health care requires a doctor's order, must be approved by your insurance. My grandma had Medicare at the time. And also, her primary care physician was able to give her a doctor's order for a hospital bed, um, blood pressure cuff. She even got a BiPAP machine. She even got a wheelchair. She got a walker. Okay, so all that required a doctor's order in order to use her insurance. So if she wanted to buy it herself, she can get it from Amazon, she can get it from wherever, but we wanted to utilize her insurance. So she had Medicare. So so figure out what does your loved one need? What does your nana need? Is it non-medical home care, which help with daily life activities like grooming, non-medical meal prep, transporting to your appointments, all those things is what we provide for our agency too, right here in Maryland. But I am in the Sunshine State right now. Um, so decide on what care you need. If you need home health care, that requires a doctor's order. So make sure you remember that, write that down. Okay. And then it must be approved by your insurance company. So my grandma, like I said, she didn't qualify for other programs, so she had to make a decision. We made one with her. We helped her, and she decided she was gonna be self pay, how to pay because there weren't any programs. Right? I called all over a county. I called PG County where she was living in. I called the state of Maryland. There were no programs she could qualify for because they said that she exceeded the income, right? So she worked for all her life and she didn't qualify. So, anyways, decide that. The next step is to decide on how many hours that you need for care. My grandmother initially needed like full time care. It must have been 40 hours a week, right? But then when she got better, the hours went down, right? So she needed help Monday through Friday, even the weekends. And even when we came to help, we still needed more support. So the non-medical home care agency came in, which we do now, help with bathing, grooming, housekeeping, laundry, meal prep, transport to appointments. So there were times I was on a call with a caregiver in her medical appointment. I was asking questions because I couldn't get off work, and that allowed me to be present in my grandma's care house. So decide how many hours you need, write that down. Then you want to call around, do research to make sure that the agency meets what you're looking for. Some agencies require a minimum of 20 hours per week in order to be in their program. So find out which one that you require. Okay. So we needed full time, then we dropped down to like 20 hours or so. We just give or take, right? So figure that piece out. And that's pretty much it today. So once you figure out what type of care you need, is it home health care? Is it non-medical home care? Figure out how many hours you need. Is it 20 hours or whatever the company may offer? It could be, it just depends. We in Maryland, we do our agency a minimum of 2 to 3 days a week, 2 to 3 hours a day, because we know my grandma did not need that much care, but we had to go with the agency because they didn't offer anything lower than 20 hours a week, right? So we are meeting the clients right where they are. So we are based in Maryland. So you have any family members that are in Maryland, let me know. Um, who's looking for home care, and then let me know in the comments down below, like what challenges you may have experienced with non-medical home care, and I will share my personal experience. This is only my personal experience. Okay. All right. Have an amazing day. And don't forget that if we don't advocate for our seniors, our loved ones, who else will? Right? I advocated for my mom when she was in the hospital, my brother for that short time, and my grandma. All right. So have an amazing day. And let me know in the comments where you are checking in from. Let's go.